Hi, this is Dr. Farley. This is my first blog video for the year 2022. We moved into a much bigger facility. We have a very nice small health and wellness, I call it hospital right now, and we're going to be doing a lot of expanding, helping a lot of different cases. Um, so it's pretty exciting. New location is great. So today, what I want to go over was I just had a couple patients ask questions about the safety of vitamins and minerals, and does it cause liver damage? And so I also want to review with you a paper by Dr. Gary Null, Carolyn Dean, Martin Feldman, and Deborah Razio that was published in 2005. And it was called Death by Medicine. And it basically reviewed how dangerous are drugs. So, but before we get into that, I just want to talk about this question for a second also. The Orthomolecular Medicine Society basically did a complete review of all existing science databases and looked to see how many deaths there were with vitamins. And this was done in 2017. And basically what they found is there's no deaths from vitamins. None. Zero, zip, zilch. Okay? So the concept that you're going to take too many vitamins and minerals and they're going to be dangerous to you is a myth. It does not exist. Most of society is in what we call pan deficiency. Totally depleted. Depleted. So our vitamins and minerals essentially, there are no side effects. There are no deaths. Yes. Again, let me go clarify that for a second. Might you get a little bit of a side effect of something and you back off and the side effect goes away? Yeah. Are there long-term consequences? Zero. Are there any deaths reported? Zero. None. Now let me go into one more thing. How about this? How about from supplements, from minerals or amino acids, homeopathics or herbs? None. No deaths reported. None whatsoever. And this was from the U.S. National Poison Data System, and it was published in the Journal of Clinical Toxicology. So what's our concern about vitamins, minerals, supplements, amino acids, homeopathics, and herbs? There should be none. There should absolutely be none. Now, I want to go into the dangers of drugs and the medical system for a second, because this is a major thing that people need to understand. So when you're pursuing your health by looking at what you can do to make your system work better, which would include foods and vitamins and minerals, you are working within normal anatomy, physiology, and biochemistry, and that's why there are no deaths, there are no major side effects of doing that process, because that's how the system works. And health is how the system works. If you do not restore how the system works, and all you're doing is maybe possibly managing a symptom with a drug, every drug you take adds to your what's called iatrogenic pharmacological allostatic stress load. Means doctor drug induced. So you're taking a system that is overloaded with a high allostatic stress load. We're then throwing more drugs into a stressed out system, creating more stress to a stressed out system. And then how dangerous is that? Very. Let me just go through some of the numbers with you. So the total number of deaths, iatrogenic deaths, shown in Table 1 from this research was 783,936 deaths. Per year, by the way. Per year. What does that mean? That means that the medical doctors and the pharmacological complex is the number one cause of death in the United States. And let me just jump to the final conclusion of this. It says, we have outlined in this paper are insupportable aspects of our contemporary medical system that needs to be changed, beginning at its very foundation. When the number one killer in society is the healthcare system, that system must take responsibility for its shortcomings. It's a failed system in need of immediate action. a failed system in need of immediate action. I absolutely agree. I see people coming in here with way over medicated, not addressing how the system works whatsoever, and it's a joke. We just keep spinning our wheels, wondering why we're not getting anywhere, wondering why our loved ones are dropping dead, wondering why everyone's health is going down, down, down. That system does not, cannot, will not ever produce health. Let me be clear with one more statement here. There are no drugs required for health. Be clear about that. There are no drugs required for health. If you're taking a drug for a symptom, you are adding more stress into a stressed out system. If the drug manages your symptom, that's all it's doing. It does not restore health. It cannot, will not, does not. So if we understand that, then I think we should pick our head up and realize that the goal, if we're trying to be healthy, is to not use the medical doctors and the drugs, because they're not providing health care. They're providing disease crisis intervention. Let's get clear in that. We don't require drugs to be healthy. And if the drugs have massive side effects that we're going to go through right now, and this system is actually the #1 cause of death in the U.S., I have to question, what are we doing? Why are we following this? And the answer is a lot of people are not. A lot of people are not. They're doing their own research. They're looking into how their bodies work. They're trying to ask good questions. And by the way, if you go back to your medical doc, the allopathic doc, that only has drugs in their toolbox, that's it. And you ask them questions, well, you get very arrogant answers back. You don't get any answers whatsoever. They'll tell you, don't do it, you're going to waste your money. Oh, it's dangerous. I have people tell me all the time, oh, my doctor wants to see the vitamins and minerals that I'm taking. Great. Tell your doctor to call me and we'll find out what his knowledge is in the vitamins and minerals, because they have no training. Zero, zip, zilch. They get no training in nutrition, no training on vitamins and minerals. And by the way, how many people die every year of vitamins and minerals and supplements? Zero, zip, zilch. Okay, so with that said, let me go through some more numbers here. It's pretty unbelievable here. So, hospital admissions of people that die, 106,000. Medical errors, 98,000 people die. Bed sores, 115,000. Infection, 88,000. Malnutrition, 108,000 people a year die. Outpatient adverse drug reactions, 199,000 people die. Unnecessary procedures, 37,136 people die. Surgery-related deaths, 32,000. The cost of these deaths, that totals 783,936 people a year, every single year dying, and is the #1 cause of death in the U.S. This is the numbers back from 2005, was $282 billion. Oh my God. Oh my God. Massive amounts. The other thing I want to tell you is this. How much is being reported? Well, only about 5 to 20%. So these numbers could be 80 to 95% higher, because only 5 to 20% of these gets reported. What else? #1 worst side effects are the depression medications. #2 are the non-steroidal anti-inflammatories. And #3 are the calcium channel blockers. The leading adverse reaction classification of drugs: antibiotics, cardiovascular drugs, chemotherapy, and anti-inflammatory drugs. Another thing you want to know is this too. I hear this too. Well, the vitamins and minerals, are these FDA cleared? They don't have to be FDA cleared because they're normal and natural to the system. Does water have to be FDA cleared? Does exercise have to be FDA cleared? No, because they're normal and natural to the system. Okay? So you don't need the FDA to regulate, and you hopefully will never have that happen, to regulate our vitamins and minerals and supplements, because they are not drugs. And when they are not drugs, they don't have the safety complications that drugs do. 1/3 of all drugs will be removed once they enter the market. 1/3 of the drugs that you're probably taking will be removed from the market. 50% of drugs had serious post-approval risks. That means once we splash them on society, now we're seeing, uh-oh,